Biont Hacker here. Why your clients aren't getting better. The missing layer in integrative practice. I'm Jodi Duval, practitioner, mentor, educator, CEO of HOMeHOPe Australia, and we teach practitioners how to move upstream using molecular and systems biology rather than chasing symptoms or correcting syndromes. So this is the HOMeHOPe layer that changes everything. You're doing everything right. You've got targeted supplements, you've got advanced labs, you've got gut protocols, hormones, diet, lifestyle, but something still might be missing. Clients plateau, symptoms cycle, they feel almost better, but never fully optimized. Here's the problem. So most integrative models are still operating inside a dysfunction-driven framework. HOMeHOPe replaces that entirely by focusing on what's missing, not what's broken, and enabling what is well to be better. So if you're still fixing deficits instead of optimizing networks, most tests like GI mapping, Dutch hormones, food sensitivities are still framed around identifying the dysfunction. HOMeHOPe teaches you to identify what's missing in upstream inputs: electrons, enzymatic cofactors, micronutrients, redox balance, circadian signaling, and cellular tone. So before dysfunction actually manifests. Biochemistry that we look at is the map. It's not the diagnosis. So we recenter clinical care around that foundational data: organic acids, fatty acid metabolism, amino acids, redox markers, mitochondrial function. So when the practitioners master these biochemical signatures, they build the true clinical clarity and create reproducible outcomes without endless troubleshooting. We're looking at the individual person's cellular environment. This is where most functional medicine fails. We're looking at that clients don't need this endless repletion protocol. They need precision, the ratio balancing, they need precision testing, they need to be looking at certain levels. When we do hormone balancing, you'll see the cortisol, DHEA, progesterone, estradiol, free T3, 3T4 in terms of the thyroid. When we actually look at some of these correction and detections, we are actually detecting what is incorrect at the time and we're correcting. We're allowing the system to network range. We're looking at it to be correcting. In the systems thinking, this builds that resilience, not the practitioner dependency. And instead of treating individual pathways, we're actually restoring system capacity and adaptability while looking at those individual markers like a dashboard. So clients then stop chasing the protocols, they stabilize, they look at building resilience and recover that long-term function. And they're even looking at it in a complex, unexpected cases. When we look at a person, we see that they're individually mapped. So why would we do it at a broad spectrum protocol and only look at those targeted protocols for every single individual person? It has to be a systems thinking for an individual person. HOMeHOPe is that clinical operating system that most practitioners have actually been missing. They're looking at not just another tool or a protocol, which is what is being pushed out all the time for us as clinicians and practitioners. It's this clinical framework, it's a diagnostic rhythm and a biochemical map that gives practitioners confidence, precision, clarity across any of the modalities or specialties. You as a practitioner can come and learn this as a basic. It's that foundational level of health optimization, and it goes far beyond any protocol that you can learn that's been mapped for a non-detection, correction, and a baseline. So if you're a practitioner who knows that there is a deeper level of care, who's ready to move beyond that patchwork functional protocol into true systems biology, HOMeHOPe is your next step. And so we have a certification pathway. We don't just upgrade those outcomes, we're still permanently looking at how you can think about the body. And once you see it, you really can't unsee it. Ask us questions, send us any information that you wish to know. And I, for sure, have so much passion because it just makes so much sense to be treating and supporting people in this way. And the benefits are unbelievable. I see it daily in my practice, and it can be applied across any of the clients in their lifespan.